Before I got the dentures, you know, I was overly concerned because the roots of my teeth were cracking. I was concerned with what I ate and how I ate, and even where I went and what I did. I just never felt comfortable. I actually feel more comfortable with the, you know, implants, dentures, than I did with my regular teeth because they were so unpredictable. And then I was always having discomfort or pain. I can eat anything I want. I'm comfortable with it. I feel comfortable eating out now, whereas before I didn't. And if I'm talking to people and I become close enough, affectionate with them that I will talk about it, I feel comfortable saying, oh yeah, I have dentures. And they go, wow, I would have never known if you had not told me. And it just looks perfectly natural and normal, and I'm happy. I never thought this was a point that I would get to. It looks natural. Nobody would ever think or ask me, hey, what's wrong with you? They all say, people say to me now, Ma, your teeth are so pretty. It was better than I could have imagined.
Join Dr. Joseph Massad and guests as they educate and enlighten listeners around the world with unique patient cases and technology. Brought to you by the Massad Learning Center. For more information on how to take your practice to the next level, visit our website at joemassad.com. This is Dental Discussions with Dr. Massad.
Hey, welcome. Right now we have the one lady that I had the A team come in and take care of you.
Yes.
Okay, Mrs. Watts.
Thank you for having me.
Yeah. And this is what, when you guys come, this is what you're going to do. You're going to get to see these patients, and you're going to get to see how we've done all of these cases, okay? So you came in.
Hi, Dr. Massad.
Hey, how are you?
I'm doing great. How are you?
Hey, nice to see you.
Good. Thank you.
Come on, sweetie.
I've been doing really well. You would be surprised. And it's making me feel a lot better. I've been seeing this new doctor, and I think it's going to help a lot, even with my mouth, because it's helping to, you know, stimulate my body and make blood circulate.
No.
I'm thinking it's going to be really great. I had conditions with scleroderma and Raynaud's, so it affects the tightening of the skin and the blood vessels, so blood doesn't circulate properly, and I don't have the correct amount elasticity that people normally have in their mouth, skin, and whatever.
And this is the reason why fixed in her case would be the absolute best. We didn't want to have too much space, but we wanted to have enough space to clean.
Right.
Okay. And when we put the fixed case in, but I just put it in with a nylon,
Right.
just to make sure all the occlusion was perfect.
Mm-hmm.
And then we put these in.
Okay.
There'll be a big difference.
Right.
Okay, so we put in the ones that are tight, right?
Okay.
The reason we put you in the temporary is I wanted to make sure everything was fine and then take it out and put in your particular case.
Right.
Because you don't have any stretch of your tissues,
Right.
okay? Then you felt that, but now you don't. It's like, and we locked it in.
Mm-hmm. It feels much better. It's not moving. It's not sticking down in the gum on the side there. I'm very positive. I feel great. Yes.
Your teeth are smaller now, aren't they?
Yes, they are.
And nice.
They are.
So how's it going?
It's going really good. I was a little nervous at first. Like I said, when I realized that all the teeth I had left, the few that were there, had to come out. But it became surreal to me. And
after I met you, I had a really good peace about it because you're like my other dentist, very kind, very caring, and very gentle. And that was important because I had very little elasticity in my skin. And so going to the dentist was always traumatic for me. But you put me at peace, and all your helpers and Sarah and everybody here, they were just very kind. So it's good to be at peace about what you're doing before you do it so that it can work well. And even Dr. Shirley, he was amazing with his team. So it all went great. And the recovery was absolutely amazing.
So I had to send you all the way to Nacogdoches, Texas, because I knew he was the one that needed to do this for you. You have these Zigomas, right, and implants,
Right.
okay, and you know, he's a medical doctor and he's a maxillofacial surgeon and oncology. So that was I think your procedure was close to what, 8 hours?
Yes, they said it was going to be 4, and so my husband and our best friends went with us. And so they told him to go eat or something. And so at the 4 hours, they weren't calling. So my husband was calling them. And I was the first patient there. And I was the last patient literally to leave. That's how long I was there. So, but I didn't know, you know, because I was asleep, thank God. But he did a great job. And the aftercare with him was very well. And they occasionally check on me and send me messages. So it was the perfect team.
Yeah.
So.
And we had the A team start. And remember, I had made 3 prosthetics but he was really happy because if something broke during that, he would, you know, I want them to be, you know, really comfortable.
Equipped, yes.
Yeah. Yeah.
It went well. And I mean, there were no problems. And I remember when I first went to Texas to meet him the first time, and he really made me feel good because I knew my mouth was a challenge. And when he saw me, when he first met me, he says, I feel confident that if I needed to do this right now, I could do it right now. And even though I knew that he didn't have everything he needed, he was so confident that it made me feel so much better. And I felt that it was a perfect match between the two of you to help me get to the destination that I needed to get to. Johnny O, I thank you very, very much for all of your work, for everything you did to help me, and everything you did to help me have my $1 million smile. I tell people about you all the time in Texas that they need some work. I say, you need to go to Nacogdoches and see Dr. Shirley. So I'm kind of like a walking billboard for you.
Yeah. Thank you.
You're welcome.
You've been listening to Dental Discussions with Dr. Massad. For more information on how to take your practice to the next level, please call our office at 918-749-5600 or visit our website at joemassad.com.